Hello and welcome back to our channel. Today we delve into a complex and often misunderstood mental health disorder, schizophrenia. This condition, characterized by a spectrum of different symptoms, is more than the sum of its parts. It's a testament to the complexity of the human mind. As we journey through this topic, we'll reinforce the importance of understanding, empathy, and open discussion about mental health issues. In the next few minutes, we will uncover the causes of this disorder, so stay tuned. Schizophrenia, a serious mental disorder, affects how a person thinks, feels, and behaves. It's not simply a case of having a split personality, a misconception often perpetuated by popular culture. In reality, schizophrenia is much more complex and multifaceted. People living with schizophrenia may experience a variety of symptoms, which can be broadly categorized into three types: positive, negative, and cognitive. Positive symptoms refer to those that most individuals do not usually experience but are present in people with schizophrenia. These include hallucinations, delusions, and thought disorders. Negative symptoms, on the other hand, are aspects of a person's behavior or thoughts that are lessened or absent. This could mean a lack of pleasure in everyday life, difficulty beginning and sustaining activities, or reduced speaking. Cognitive symptoms often are subtle and can be detected only when specific tests are performed. These symptoms include trouble focusing or paying attention, difficulty with memory, and an inability to understand information and use it to make decisions. The impacts of schizophrenia are profound. It can affect every aspect of a person's life, including relationships, work, and self-care routines. It's not a condition that someone can simply snap out of, but rather, it's a chronic condition that requires long-term treatment and understanding. Now that we have a basic understanding of schizophrenia, let's move on to discuss its causes. While the exact cause of schizophrenia remains unknown, several factors contribute to its development. This statement may sound a bit cryptic, but let's break it down. Firstly, let's talk about genetics. Schizophrenia tends to run in families. However, it's crucial to note that just because someone in your family has the disorder, it doesn't mean you will develop it. While genetics play a role, they aren't the sole cause. It's a little like a jigsaw puzzle. Certain genetic factors may make you more susceptible, but they're only part of the picture. Moving on, let's explore the impact of environment. Certain environmental factors can trigger schizophrenia in people who are genetically predisposed to the condition. These factors may include things like exposure to viruses, malnutrition before birth, problems during birth, and psychosocial factors. Now, let's dive into the realm of brain chemistry. Researchers believe that imbalances in the brain's chemical makeup, particularly involving neurotransmitters like dopamine and glutamate, may contribute to the onset of schizophrenia. These chemicals play an essential role in the functioning of our brain and how we perceive the world around us. Lastly, we look at brain structure. Some studies have found that people with schizophrenia have subtle differences in brain structures compared to those without the disorder. These variations are believed to occur during brain development in the womb or early childhood. The interplay between these factors, genetics, environment, brain chemistry, and structure, is complex. It's a bit like a symphony with every musician playing a part. When all the elements are in harmony, the music flows beautifully. But when one instrument is out of tune, it can disrupt the entire performance. The same is true for our brain. When everything is working as it should, we function normally. However, when something is off, be it our genes, our environment, or our brain chemistry, it can lead to conditions like schizophrenia. Understanding these causes can help in early detection and treatment, but how does schizophrenia coexist with other conditions? Let's find out in our next segment. Schizophrenia often doesn't occur in isolation. Many people with schizophrenia experience other mental and physical health conditions. In fact, the coexistence of schizophrenia with other conditions is more common than one might think. It's like a complex tapestry where each thread intertwines with others to form the overall picture of a person's health. Consider depression, for instance. It's not uncommon for someone with schizophrenia to also struggle with feelings of sadness, hopelessness, or a lack of interest in life. This combination can be particularly challenging, as the symptoms of depression can sometimes mirror or even exacerbate the negative symptoms of schizophrenia, like social withdrawal or a lack of motivation. Then, there's anxiety disorders. People with schizophrenia may also wrestle with persistent fears or worries, which can create a sort of feedback loop with their psychotic symptoms. For example, paranoia, a common symptom of schizophrenia, might be intensified by an underlying anxiety disorder. Another thread in this complex tapestry is substance use disorders. Some individuals with schizophrenia may turn to alcohol or drugs as a way to self-medicate or manage their symptoms. However, this can create a vicious cycle, as substance abuse can worsen schizophrenia symptoms and make them harder to treat. Each of these coexisting conditions can complicate the treatment and management of schizophrenia. They can mask symptoms, making it harder for healthcare professionals to accurately diagnose and treat the condition. Moreover, these conditions can interfere with a person's ability to adhere to their treatment plan, potentially leading to poorer overall health outcomes. But here's the good news. By understanding these complexities, we can better tailor treatment plans to address not just schizophrenia, but also these coexisting conditions. This holistic approach to treatment can lead to better management of symptoms and improved quality of life for individuals with schizophrenia. Now let's go through some ways to support individuals with schizophrenia. Supporting someone with schizophrenia requires understanding, patience, and appropriate communication. When interacting with a person affected by schizophrenia, it's crucial to maintain a calm and supportive environment. Stress can exacerbate symptoms, so aim to minimize it. Always use clear, simple language and allow the person time to process what you've said. It's important not to dismiss or ridicule their experiences, no matter how unrealistic they might seem. Validate their feelings, even if you can't validate their reality. Professional help is a key part of managing schizophrenia. Encourage your loved one to seek medical assistance and ensure they adhere to prescribed treatments. Medication is often a necessary component of managing schizophrenia, but keep in mind that it's not a one-size-fits-all solution. Different individuals may respond differently to various treatments, and it may take time to find the right fit. Supportive therapy can also be highly beneficial. Cognitive behavioral therapy, for example, can help individuals manage symptoms and improve their quality of life. Family therapy, too, can offer a platform for everyone affected to express their feelings and concerns, fostering a sense of understanding and unity. Remember, it's not just about managing the symptoms of schizophrenia, but also about enabling the person to lead a fulfilling life. Encourage them to pursue hobbies, maintain social connections, and set achievable goals. It's essential not to isolate them or treat them as if they are defined solely by their condition. Also, self-care cannot be overemphasized. If you're supporting someone with schizophrenia, it's important to take care of your own mental and physical health as well. Seek support when you need it, and remember that it's okay to take a break. You can only give your best when you're at your best. Finally, always keep in mind that patience is a virtue. Progress may be slow, and there may be setbacks along the way, but with the right support and treatment, recovery is possible. Remember, every individual's experience with schizophrenia is unique, and so is their path to recovery. Schizophrenia, though a complex disorder, can be managed with the right support and treatment. Today, we've explored its causes, symptoms, and the dynamics of coexistence. Remember, understanding is the first step towards creating a supportive environment for those living with this condition. Thank you for joining us in this important discussion. Please share this video to raise awareness about schizophrenia, and don't forget to subscribe to our channel for more insightful content. Until next time, take care.